Hi everybody, I'm Dr. Kaylee Lee. I'm a board certified OBGYN and this is my first YouTube video on my channel, Girlfriend Gyno. It's almost the end of October and it's Breast Cancer Awareness Month in October, so this episode is all about that, specifically about knowing your risk. Previvor Day is actually October 1st. What is a Previvor? It's somebody who has a genetic mutation that predisposes them to cancer. It can be breast cancer. And knowing your family history is hugely important in finding out your personal risk. So I really encourage you to talk to your parents, your aunts, uncles, cousins, grandparents about your family history. Bring that with you to your annual GYN exam. Give that to your doctor so you can have a discussion about it, and they can put it into one of the online risk calculators. There's the Tyler Cuzick risk calculator. It's been in the media a lot recently because Olivia Munn has been talking about it. She was found to have breast cancer on an MRI that was ordered by her doctor after being identified as being high risk based on her Tyler Cuzick score. So a Tyler Cuzick risk of 20% or greater of getting breast cancer in your lifetime is considered high risk. With the Gale model, it's 1.67% or greater risk of getting breast cancer in the next 5 years. And so these can be accessed online. Your doctor can input answers that they get from you from questions on the calculator. If you are identified as being high risk, you can elect to do enhanced breast cancer screening. This is an alternating mammogram and MRI every 6 months, so you are getting imaging done twice a year. This is in hopes of finding breast cancer at an earlier stage. It is not preventative. There are other preventative strategies that you can consider if you are found to be high risk. And there is something called chemoprevention. This is taking medication. The only approved medication for premenopausal women is tamoxifen. It is a selective estrogen receptor modulator, so it binds to estrogen receptors, and it is specifically meant to decrease your risk of estrogen receptor positive breast cancer. It's usually taken for about 5 years, and there are side effects to its use like any medication. If you were considering this, you should talk to your doctor who's going to prescribe it about those potential side effects. For postmenopausal women, there's more medications that can be used, including aromatase inhibitors. These decrease the production of estrogen. Again, they are for estrogen receptor positive breast cancers. Another way of preventing breast cancer is through prophylactic mastectomy. This is a surgery where your breast tissue is removed. You can elect then to do reconstruction. Reconstruction can be done in various ways. I have just had a prophylactic mastectomy myself in July. I am 3 months out from that surgery. It was not an easy recovery, but I'm very glad that I did it. I want to talk about what led me to that decision. My mother has a family with a long legacy of breast cancer. She herself had a prophylactic mastectomy at 28 or 29 when she was done having children. She had watched her mother and 2 aunts go through breast cancer and die before the age of 50. Her grandmother, my maternal great-grandmother, also had breast cancer twice. Fast forward to the mid-90s, BRCA1 and BRCA2 gene mutations were identified, and my mother was found by a hereditary cancer clinic that was looking at families that had a long history of cancer. She was offered BRCA1 and BRCA2 gene mutation testing, and she did it. She was found to be negative. She received a letter in the mail stating that her daughters were at average risk and no further evaluations or actions needed to be taken on our part. So we went with that for many years, up until about 2 years ago. The rug, metaphorically, was pulled out from underneath us. My sister was diagnosed with breast cancer at age 43. She underwent genetic testing and was found to be positive for BRIP1 gene mutation. This is a lesser known gene mutation even amongst the medical community. It's a more newly identified gene mutation. There is some thought that it can increase your risk of breast cancer. It does increase your risk of ovarian cancer. I also then went to a genetic counselor, and I brought with me a very thorough family history. I was lucky enough to have that. My genetic counselor then ordered the appropriate gene panels to see if I carried any genetic mutations. I was identified as also being a carrier of the BRIP1 gene mutation. I used the Tyler Cuzick risk calculator to find that my lifetime risk was greater than 20%. I elected to do enhanced breast cancer screening. I had an MRI. Over the next year and a half, I decided that I wanted to do something more preventative and decided on the prophylactic mastectomy. Again, I'm very glad that I did this surgery. I had a screening mammogram before the surgery and it was abnormal. I had to wait about 6 weeks before getting a diagnostic mammogram and ultrasound, and that period of time was very stressful and anxiety producing. I'm very glad that I did do the surgery because hopefully I'll never have to go through that again. The surgery does not bring your risk of breast cancer down to 0, but it is significantly reduced.